मैम हो गया स्टार्ट, वो लिंक भेज दो, देख लेंगे वो कैसा क्वेश्चन। क्या बता रहे हैं?
हेलो, स्टार्ट नहीं है। हेलो, am I audible and visible everybody? Just a second. Okay. All right. So, good afternoon, everyone. All right. So, this is a short session where we'll be looking at some of the important FMG MCQ marathon. Okay, it's a part of a marathon which is happening on the Unacademy. Okay, it's happening on Unacademy. This. Okay, now I think I can see everyone. Alright, so it's happening on Unacademy Desi Doctor channel where we are running a FMG MCQ marathon. ठीक है, so currently we'll be doing PSM questions. Alright, happy Makar Sankranti. Yes, everyone, be safe, be happy. ठीक है, before I begin, please remember at Unacademy also we have launched the NEET PG Vitals now, which are the recorded videos. ठीक है, for comprehensive NEET PG preparation. For NEET PG, you can cover the video Venus, which I have just taken in the month of November and December. Okay, there's a course which I have taken in the month of November and December, so you can cover that one. Okay, it's there on the Unacademy app as well. So what I was saying is that at Unacademy we have launched the NEET PG Vitals, which is both recorded videos are now available to you, which will help you in your NEET PG preparation. Alright, there's a special launch price of 13,500, so you can definitely subscribe, use my code PSM10 and you can avail this launch price offer also. It's 800 hours of recorded class by your wonderful educators who are there on Unacademy. Alright, also these are the recorded, you'll get an access to the recorded videos for your comprehensive NEET PG preparation. So these are your wonderful educators who've recorded the app, recorded the videos for you. Okay. Also at Unacademy we have started with a rankers batch which has just started on the 10th of January. So you can use my code PSM10 where all these wonderful educators are a part of this batch course. Okay. So you can definitely think of taking, if you want, you can use PSM10. This is the last extra edge. It's going to give you an extra edge to your preparation, everybody. Okay, that's the rankers batch. Okay, so you can get 2-month subscription at 6,999 only. You can use my code PSM10. Also, we have now Unacademy notes. So those are rupees 7500. It's absolutely free with the NEET PG combo, which is the live and recorded ones. So you're also going to get the Unacademy notes, okay, along with the recorded lectures that the educators have recorded for you. Okay, so these are again certain advantages of taking up the platform. Also, there's the last leap marathon for NEET PG, which is starting from January 20 to February 25, where there'll be 102 hours of dedicated rapid revision by all your educators on the platform. Okay, so every day, one day would be allotted for all the subjects, and we're going to cover almost everything which is needed for your NEET PG preparation. Okay, that too you can get an access at 6,999. You can use my code PSM10. So a lot of things happening, and you can select the best one, whichever you would want to prefer out of these. Okay, all right. And to help you practice, on 22nd Jan at 9 AM we have an all NEET PG All India mock test. All right, so let us start now. Let's see a few MCQs, 10 to 15 MCQs we'll be doing in this session, and let's see how you perform in them. Okay, so look at the question. This is the first question. Researcher was conducting. Okay, so the first question is, researcher was conducting a study in relation to depression associated with history of social media usage. One group had social media users with depression and another group had social media users without depression. Which type of study design is this? So what is your answer? Very good. Now see, I've just put this is actually a PYQ. Okay, I've just included it so that you get an idea how to approach any study design. So whenever you have to approach any study design, okay, whenever you have to approach a study design, what have I taught you? The first thing that you have to figure out is what is the exposure and what is the outcome. Okay, that's the first thing that you have to figure out. What is the exposure and what is the outcome? Okay, and then you have to see, are you comparing, okay, what are you comparing? Are you comparing exposed versus non-exposed? Okay, do you compare exposed versus non-exposed, or are you comparing diseased versus non-diseased? Okay, and then you have to also look at the arrow. Okay, where is your study proceeding? So you also have to look at the direction of proceeding. Okay, where is the study proceeding? Okay, you will see this and then you will see the direction. Is it clear? These are the things that you have to notice. What is the exposure? What is the outcome? All right. What are you comparing? Exposed, non-exposed, and where is your arrow proceeding? The direction of the arrow. Also now, is it a rare event or not? Is it a rare event or not? Now, if you look at this, is it a rare event if you see depression and history of social media usage? So is depression a rare outcome? Of course, depression is something which is very rare. See, we might say that I suffer, like you might think that you're suffering from depression or you're not suffering, but rare outcome, of course. But are we all clinically diagnosed? No, we are not clinically diagnosed. So since depression is a rare event, okay, whenever you have a rare event, you can plan a case control. Plus, there was a term over here, history of social media usage. History means you have to go back. And in which study design do you go back, everybody? In which study design are you going back? So, in a case control study, in a retrospective study. So, what are you doing over here? In this, you can just start with the population. Okay, you can divide them into two groups, which is depressed, okay, and non-depressed, okay, and then what you can do, you can just go backwards and ask them about whether they use social media or not. Okay, so you can ask social media use, okay, not used, okay, and similarly over here, did they use social media use, not use? No, for rare disease you will always use a case control. Okay, you will just go backwards. Okay, so for the rule is that for rare disease, what should you use? Why do you want to follow them up in the future? It's not required. For any rare disease, we can always use a case control. Just start with that. Okay, for rare disease, you will always use a case control. So it is highly predicted that this sort of question will come again in your exams. As we proceed forward, I'm going to give you another MCQ where you will have to identify. So look out the word, look out the things, what is exposure, what is outcome, what are you comparing, and what is the direction of arrow proceeding. Are you going forward or are you going backwards? Okay, so that's how you can identify. Also remember one thing, if there is a rare disease, okay, what are you going to use? You will always use a case control. Okay, but if there is a rare exposure, for a rare exposure, you can definitely use a cohort, but for a rare disease, you will use a case control. All right, plus with study design, say you can analyze multiple exposures and multiple outcomes. With study design will help you study this multiple exposures के लिए which study design you can go? You start with the disease, go backwards. So multiple exposures is case control, and multiple outcomes divide into exposed, non-exposed, go forward. So multiple outcome is cohort. Very good. Okay. Chalo, next. Now this model is again expected in your exam. What is the name of this model which can come in your exams? What is the name of this model? Identify the image. Is it population cycle or is it a demography transition model? This is a very important question which can turn up in our exams. What is it? Is it a population cycle or is it a demography transition model? Very good. This is a demography transition model. Okay, it's a demography transition model. It's simply saying that when a country evolves or goes through various phases, okay, how is it progressing from one stage to another? Okay, so I'm just going to now revise with you because we have discussed this many times. Like the first stage over here, you can see high stationary. High stationary matlab what is happening in high stationary phase? You have to tell me. What happens to the CBR and CDR in high stationary phase? Who's going to tell me? We have seen this many times. And this model is governed by something known as demographic gap. Okay, and what is demographic gap? Nothing but CBR minus CDR. Okay, so in the high stationary phase, what happens to CBR and CDR? Very good. Both are high. Good, Manish. So CBR is also high, CDR is also high. So, and what is stationary? Stationary here reflects population is stable. What happens in stage 2? What happens in stage 2, guys? Hospital services start developing, so CDR starts to decline. Okay, CDR starts to decline, but CBR is still high. Okay, CBR is still high. So what happens because of this? What will happen to the population? The population is going to expand. Okay, so that is known as early expanding. What happens over here? In early expanding phase, the population is going to expand. Okay, it's growing at a faster rate. Very good, faster rate. Then what happens finally? Hospital services get even better, so CDR continues to decline, and now we are concerned about family planning services. So family planning services की वजह से CBR starts to decline. Okay, crude birth rate starts to decline. CDR is already declining, and now CBR को क्या होता है? The CBR starts to decline. So again population will grow but at a slower rate, which is late expanding. And finally, both CBR and CDR are going to come low and low. So that is what is known as low stationary. Don't forget to revise demographic cycle. And in the last stage, what happens? The CBR, okay, becomes less than CDR. So what is this phase? This phase is known as declining phase. Okay, so this is very, very important. So since they asked you about demographic transition model, here they can ask you where is the demographic gap. India is in the third stage. Yes, Manish, India is in the third stage in the late expanding phase. Okay, now they can ask you where is the demographic gap minimum. So where can you see demographic gap as minimum, everybody? So demographic gap minimum किस स्टेज में है? In stage 1 as well as stage 4. 1 and 4. Where is the demographic gap maximum? Maximum कहाँ है? Which stage? So it is in the late part of stage 2. Okay, it is in late stage 2. And where does the demographic gap starts contracting? Where does it starts contracting? So that is early stage 3. Okay, early stage 3. It starts contracting. And where is it negative? So that is in stage 5. Okay, stage 5 mein demographic gap becomes negative. Clear? So you have to remember demography transition model. Remember that no country wants to be in stage 2 because stage 2 is a stage of demography trap. Okay, this stage is known as demographic trap. Okay, no, ideal phase nahi hai, Ratan. Ideal phase is not phase 2. Phase 2 is a phase where the country has got trapped. Look at the name, early expanding. population is growing at a faster rate, so the country is trapped in that phase. Okay, so it's a phase which no country wants to be in. All right, so that is what is known as demographic trap. Okay, it's a phase that none of the countries would want to be in. Okay, that is phase 2, and countries would actually want to be in stage 4. India is currently in the late expanding phase. Okay, understood? Can we move to the next one? All right. See, demographic bonus is a different thing. Dr. Sean Murphy. Okay, demographic bonus क्या होता है? Since you have asked, I'll just tell you once. Okay, it was also asked in your exams. See, demographic bonus. Have you heard of this demographic bonus, everybody? Have you heard of this term, demographic bonus? Bonus means we are having an advantage. So, what is the advantage in demographic bonus? It is the decline in, or it is the decrease in dependency ratio, okay, due to decline in fertility. That is a different thing. Okay, when family planning services get better and fertility starts to decline, the young age dependency decreases. That is what is demographic bonus. Is it clear, Sean? Did you understand? Okay, that is very, very important. And there is a term which is demographic burden. Who's going to tell me what is demographic burden and how do you remember this demographic burden? See, you must have seen so many movies where elderlies are considered a burden. Have you seen the movie Bagban? उसमें भी elderlies एक burden consider होते हैं. So just to remember, I'm telling you, okay, burden means increase in dependency ratio. Okay, what is it? Increase in dependency ratio. Why? Due to increase in old age dependency. समझ में आया? See, bonus was, what is the bonus? Dependency ratio is decreasing due to decrease in fertility. And what is the burden? Burden is dependency ratio is increasing due to increase in old age dependency. Okay, so these two can come as your expected MCQ. And I hope you remember what is dependency ratio. Who remembers dependency ratio? Can you tell me what is dependency ratio in case you remember what is dependency ratio? What is dependency ratio? Who are called as the dependents? So dependency ratio is children 0 to 14 years, okay, plus population above 65 years, they are dependent on the working class 15 to 64 years. So this numerator 0 to 14 years young age dependency, more than 65 years old age dependency, and this 15 to 64 years is the working class. Is it clear, everyone? That is very, very important. Please don't forget it. It will definitely come in your exams. Okay, next. Chalo. Next question. In measles epidemic, 7-month-old child was given measles vaccine. When should the next dose of measles vaccine be given? Now remember, measles and JE vaccine are the most expected again in your entrance exams this time, okay, in your FMGE or NEET PG, whichever you're appearing for. So what is the answer to this? There was a measles epidemic, so a 7-month-old child was given measles vaccine. Now when should the next dose of measles vaccine be given? Give booster at 16 months, or was it 9 months, or booster at 9 to 16 months, booster at 9 months, preschool. Now ideally, when is measles vaccine given, everybody? So when do you give measles vaccine? So the thing is that at 9 completed months, okay, what is given? The first dose of measles vaccine in the form of MR1, okay, and at 16 to 24 months, what do we give? We give measles rubella 2. Okay, now here the child has been given at 7 months. Now can we give measles vaccine at 7 months? Yes. Between 6 to 9 months, okay, between 6 to 9 months, you can give measles vaccine in case of an outbreak, okay, or if the child suffers from protein energy malnutrition. Okay, can you give the measles vaccine between 6 to 9 months? Yes, if there is an outbreak or if the child suffers from protein energy malnutrition, okay, then you can definitely give measles vaccine. So now here the child was given at 7 months. So this is a supplementary immunization. This is not routine. It's something which is supplementary immunization. This supplementary immunization is not going to replace the routine one. So according to routine immunization, you will again give the vaccine at 9 completed months. So the correct answer over here is 9 months, not booster, because booster, there is no booster for measles. You just have the first dose measles rubella and you have the second dose of measles rubella. But always remember, gap between 2 doses of measles vaccine, okay, should at least be 28 days. Okay, the gap between 2 doses of measles vaccine, if we want to maintain, we can maintain it at least up to 28 days. So that doesn't mean that मान लो ये vaccine पड़ा होता at 8 months 20 days, you can still give 9 completed months में. If during an outbreak the measles vaccine was given at 9 months 10 days, then you'll have to give it at 10 months 10 days. But the thing is, never replace routine doses, okay? Never replace routine doses. They were all what? Supplementary doses. So you are not going to anytime replace the routine doses. Got it, everyone? Okay. Chalo, let's have a look at, okay, measles. What is the strain of measles vaccine? Can you tell me? What is the strain of measles vaccine? Again, an expected question. Edmonston, Zagreb. Okay, this is the strain of measles vaccine. Another question that you will expect in exam, Japanese encephalitis ka strain batana, SA 14-14-2. Okay, and Japanese encephalitis is a live vaccine. Okay, that's the strain, SA 14-14-2. It's also a live vaccine which is used. Okay. Both these vaccines are given by subcutaneous route 0.5 ml. Okay. Alright, let's see this one. A 30-year-old male presents with chief complaints of diarrhea, ascites, knee edema. He reports that his family eats food cooked with mustard oil. What is this condition? Yes, measles, rubella, right arm, Japanese encephalitis, left arm. So what is the answer to this, everybody? Can you tell me? Very good. So there's a 30-year-old male who's presenting with chief complaints of diarrhea, ascites, knee edema, and he reports that his family eats food cooked with mustard oil. So it is nothing but a question of food adulteration, okay? And what is the thing that we are expecting over here? It is contamination of which oil with which? Contamination of mustard oil. With which oil? With argemone oil. Now where is the toxin? Remember, the toxin is present in argemone oil. And what is the toxin which is present in argemone oil, everybody? It is sanguinarine. So this thing is leading to what is known as epidemic dropsy. Food adulteration is a very important topic and it keeps coming in exams, okay? It's continuously coming, so there is no escape in that, okay? So contamination of mustard oil with argemone oil, the toxin is sanguinarine and that is leading to epidemic dropsy. Inhibits the oxidation of pyruvic acid, yes, okay? And you can see there is bilateral edema of the legs, diarrhea, cardiac defects, glaucoma, death. But is this inflammatory edema? No, this is a non-inflammatory inflammatory edema, everybody. Okay, what sort of edema it is? It is a non-inflammatory edema. Okay, got it everyone? Okay, this is an Argemone mexicana flower. See, mustard oil, mustard crops are also yellow in color, and this Argemone is a weed actually. Okay, that is also yellow in color. So this one is what? Argemone mexicana flower, which is growing around the mustard fields. Okay, all right. Now what is this? This we'll just do the image of this one also. इसमें क्या हुआ है? What is the problem that has happened over here? This is also an example of food adulteration. What has happened over here? What is the food adulteration over here? So this is an example of neurolethyrism. Be very careful with the pictures, everybody. Okay, in this there is contamination, or what is it? What is happening? There is consumption of khesari dal. Okay, khesari dal, or you could say arhar dal. And what does this khesari dal or arhar dal contain? This contain khesari dal or Lathyrus sativus. Okay, and what is this khesari dal or Lathyrus sativus containing? Boa. Now khesari dal actually resembles what? Khesari dal actually resembles arhar dal. ठीक है, khesari dal actually resembles arhar dal. So even though this crop has been banned, it is still illegally grown and mixed with arhar dal. And this is what? This is an onset of which paralysis? Spastic paralysis. Okay, which vitamin is used in its prophylaxis? Vitamin C prophylaxis. ठीक है, vitamin C prophylaxis. But technically the crop has been banned. Okay, we have banned the crop. And what is the prophylaxis? Vitamin C prophylaxis. Okay, is being done over here. Alright everybody, okay. There was one more thing in the option, which was endemic ascites. So endemic ascites is due to consumption of what? Crotalaria or Junjunia seeds. Okay, endemic ascites was due to Crotalaria or Junjunia seeds. Remember this. And Crotalaria or Junjunia seeds में कौन सा toxin होता है? Pyrrolizidine. ठीक है, pyrrolizidine. And alpha toxicosis is groundnut infestation. ठीक है, this is what? Groundnut infestation with what? Aspergillus flavus. Okay, so these are certain things that you must remember. Okay, moving to the next one. Can you answer this? Probability that a person out of those tested positive on a screening test has in fact the disease. This is known as what? What is this? Probability that a person tested positive on a screening test has in fact the disease. What is this? Sensitivity, specificity, PPV, NPV. Very good. This is positive predictive value. You have come positive on a screening test. Do you actually have the disease or not? Sensitivity is just ability of a screening test to identify all those who have the disease. Okay, all those who have the disease. That is what? That is, we are identifying what? True positives. Specificity means identify all those who do not have the disease. All those who do not have the disease. So when we are saying do not have the disease, we are identifying what? True negative. But if you've come positive on a screening test, do you actually have the disease? Like you might have come screening test positive. Do you actually have the disease? Is positive predictive value. You might have come screening test negative. Do you actually not have the disease? Is negative predictive value. So what was the formula for positive predictive value? Anybody? I hope you remember. All positives, yaad hai? TP plus FP. Everything positives. What is NPV? All negatives. True negatives plus false negative. Okay, and we'll just revise it. We have to look at other MCQs. Sensitivity is if a gold standard tells that All right, if a gold standard is going to tell me that so many are positive, screening test tells in TP. And what is specificity, everybody? Out of all those who do not have the disease, only TN is identified. Okay, you just have to know the formula. Most important property of a screening test is sensitivity. Okay, okay, let's see if you can mark this. All are experimental interventional studies except RCT, field trials, community trials, ecological trials or ecological studies. What is the answer to this? All are experimental interventional studies except RCT, field trials, community trials or ecological study. What is your answer? So this is from the topic of classification of study design, okay, which can definitely come in our exams. So whenever you have to classify, classification of study design, okay, you'll divide it into two. The first one, observational, okay, observational, where we are simply observing, and the second one is interventional. Interventional is where you're giving an intervention, you're doing something, or experimental, okay, and observational is further divided into descriptive and analytical. What is the example of descriptive? Case report and case series, okay. We are just going to describe a disease in terms of what? In terms of time, place and person. And what is analytical? We are answering why and how the disease occurred. So what are the examples of analytical study designs, guys? Where you have a comparison group, case control, cohort, cross-sectional and ecological, okay. This is an example of your analytical. Interventional study design क्या होता है? In this you don't have you are not just observing, you're giving an intervention like RCT, or which are drug trials, okay, field trials, which are vaccine trials, or community trials. These are what? Preventive trials. So if you talk about ecological study, everybody is analytical. Okay, please remember this. Classification can definitely come. Which study design helps us formulate a hypothesis, everybody? If I ask you which study design is helping us formulate, so formulate a hypothesis. कौन सी study design formulate करेगी? That is descriptive. Which study design is going to help us test a hypothesis? Okay, so that is analytical. And which study design is going to help us confirm a hypothesis? That is interventional. Okay, so that's again an important question which can turn up in our exams. What is the answer to this? Case acts as its own control in which type of study expected है? Case अपना ही control act करता है in which type of study? Crossover study, retrospective study, prospective study, case control study. Where does the case act as its own control, everybody? Case acts as its own control. Very good. It's a crossover trial. You start with the population of patients, okay? You give one group new drug, all right, the other group placebo. So this is group A, this is group B. You start following them. Then there is a period washout. Take them out of their respective trials. And फिर आप क्या करते हो? The ones who are getting the new drug, you cross them over. They start getting placebo. And ones who are getting the placebo, they start getting the new drug now, okay. So case is acting as its own control. You don't have to worry about the sample size also over here, okay. So this is known as a crossover study, okay. All right, moving to the next one. What is the content present? This is again expected in FMG exams. Two things expect करोगे. एक ये वाला contraceptive and one is intrauterine device, okay. Those two are very commonly asked. One is this one that you're seeing and the other one is intrauterine device. So what is this today? Today में क्या होता है? Today, this is actually the brand name for what? See, it's written also non-oxynol 9, but this is actually the brand name for vaginal sponge, okay. ठीक है? ऐसे V shaped होता है ना? This is actually a brand name for vaginal sponge, everybody. This is a barrier method. It also contains a chemical which is known as non-oxanol 9. They have very high failure rates, okay. Plus the problem with this is, see, it has to be like after ejaculation, it has to be left for 6 hours there. It should be taken out beyond certain limit. If you forget to take it out up to 24 hours, okay, not taken out beyond 24 hours, what will it lead to? If it is not taken out beyond 24 hours, it is going to lead to TSS, okay. What is TSS? Toxic shock syndrome, okay. If it is not taken out beyond 24 hours, it will lead to toxic shock syndrome. So remember this. Similar to everything, similar to vaginal sponge, it has a V-shaped like thing, is a diaphragm, okay. Same thing for both. Alright, if counseling and screening for TB in a HIV patient is done in ICTC clinic as per NARCO guidelines, what is this level of prevention? Primary, secondary or tertiary? What is your answer here, guys? If counseling and screening for TB in a HIV patient is done in ICTC center, what is the level of prevention? Now here we are doing counseling, okay. Here we are doing counseling and we are also doing screening. So which level of prevention is it? Is it C? Some of you are writing C, some of you are writing A. Now guys, counseling, is it a way of early diagnosis and treatment? No. Here we have asked counseling kya level hai or screening kya level hai. We can counsel anybody to, so that you can counsel someone who's a chronic smoker to quit smoking. So if I counsel a chronic smoker to quit smoking, which level of prevention is that? Of course, that is primary, okay. If I counsel a smoker to quit smoking, that becomes primary. But screening everybody is which level of prevention? Secondary. So here what is the answer? Both primary and secondary. Screening is a way to make an early diagnosis, right? Screening is a way to make an early diagnosis and provide treatment. But once you talk about counseling, counseling is a primary level of prevention, okay. You are counseling someone, okay. So that is a primary level of prevention. Is it health promotion or specific protection? Is it health promotion or specific protection? It's a general thing, okay. So this becomes what? This becomes an example of health promotion. It's a general thing that is being done. So this becomes an example of health promotion. Okay, another one, can you see this? A researcher undertakes follow-up study for a certain time period duration and tells that the people increasingly develop disease with time. What is it? The people increasingly develop disease with time. What is it? So there is constant increase in cases, okay. It simply means there is constant increase in cases, okay, or in the number of cases. So this is what? Cumulative incidence, or it is also known as ogive. अब इंसिडेंस का मतलब क्या होता है? न्यू केसेस, ठीक है. एंड प्रेवलेंस मतलब क्या होता है? टोटल केसेस, न्यू ऑल्सो एंड ओल्ड ऑल्सो. सो इफ देयर इज अ कांस्टेंट इंक्रीज इन केसेस, इट टेक्स द शेप लाइक दिस. देयर इज नो डिप, okay. So that is known as cumulative frequency curve or ogive. Alright, moving to the next one. A doctor is teaching an intern about knee reflex demonstration. What type of learning is this? So what is the answer over here? A doctor is teaching an intern about knee reflex demonstration. ये कौन सा learning है? Cognitive, affective, psychomotor, or is it none of the above? Teaching knee reflex demonstration. So that is development of a skill. Okay, cognitive is simply knowledge based. Okay, cognitive is knowledge based. Affective is attitude. Okay, or actions, and psychomotor is skill. Teaching a child about hand hygiene techniques, okay. So we want to develop the skills in that person. Okay, so this we have already done. Cognitive, affective, psychomotor. Always remember, learning is something which is permanent. Moving to the next one. A group is addressed and a series of lecture is given on a specific health topic. This is an example of a group is addressed and a series of lecture is given on a specific health topic. What is it? ORS demonstration is like a form of demonstration. Okay, so ORS demonstration is actually, जब हम ORS के बारे में सिखाते हैं ना, that's a way of demonstrating. Okay, that's a way of demonstration. It's a way of health communication. ठीक है, don't go for, and when you make the person how to prepare, okay, that again, like if you call someone from the community and ask them कि बताओ कैसे prepare हुआ, उसके skill को develop करना, so that's indirectly an example of the same thing. Okay, alright, so what is the answer over here? Series of lecture. So when you have a series of lecture, that means you have a set agenda, you have set speeches, you have set order of speaking. Okay, it simply means there is a set agenda, there is a set order of speaking. Okay, there is a set order of speaking, there is a set agenda. So what is the answer to this? Of course it is a symposium. Panel में क्या होता है? In both panel and symposium there are 4 to 8 experts, but in a panel discussion, everybody, what happens in a panel discussion? There is no set speeches, there is no set order of speaking. Okay, there is no set order of speaking, or there is also no set agenda, guys. ठीक है, that is what is panel. Okay, this is very very important, which you have to remember. Series of lectures same but no set lecture. Yeah, exactly. Plus दोनों में 4 to 8 experts होते हैं. Where can the experts discuss among themselves, guys? Where can the experts discuss among themselves? So experts can talk among themselves in a panel discussion. In a symposium, experts cannot talk among themselves. Okay, and both have an audience, both have a feedback, everything is taken. Okay, so remember one more thing, that experts can talk among themselves where? Where can experts talk among themselves? So experts can talk among themselves in, आपस में बात कर सकते हैं in a panel, okay, but not in a symposium. All right, few more questions to go. All of the following can be analyzed using chi-square test, except, so where do you use a chi-square test? Remember, chi-square test is a non-parametric test, okay, and I have taught you that it is used when we are comparing which variables? Qualitative variables. Okay, we talk about qualitative variables, or we also compare what? We compare percentage and proportions. Okay, so now over here, sex and stage of cancer, sex and stage of cancer. Now staging of cancer, so that means stage of cancer, let's say it is 1, 2, 3 whatever, और इधर पे हो गया तुम्हारा sex. ठीक है, so now can I express stage of cancer in mean? No, I can say that so many 20% of people suffer from first stage. So you always have to look at the outcome variable. So this is a qualitative variable. When it is a qualitative variable, you can use a chi-square test. Benign or malignant and type of surgery, again you can use a chi-square, because type of surgery is again a qualitative variable. Age group and cancer staging, again we can use a chi-square test. But if you look at heart rate per minute and age, ये क्या है? Is it a chi-square test? No, because heart rate per minute and age you can express in means and SDs. They are quantitative variables. So whenever you have quantitative variables which can be expressed in means and SDs, you can use a parametric test, not a chi-square test. Okay, all right, few more questions. Quickly tell me the answer to this. A man came for checkup after his father had a CVA due to hypertension. Please don't forget to revise levels of prevention, actually important है. So any form of checkup, कौन सा level of prevention होता है? You go to a hospital for a checkup to make an early diagnosis of a disease. Okay, blood group, Alia, can you express blood group in means? Either you are A positive, B positive or AB positive. It's not like you can lie in between. So again, blood group is a qualitative variable. It's not a quantitative variable. Okay. Now any form of checkup will be secondary. Primordial matlab? No risk factor. Primary means what? Risk factor present, but disease not started. Secondary means what? Disease started but no complications, okay, and tertiary में complication is present, okay, all right, okay. Niti Aayog has replaced what? What has Niti Aayog replaced? नेशनल इंस्टीट्यूशन फॉर ट्रांसफॉर्मिंग इंडिया, इसने किसको रिप्लेस किया है? नेशनल इंस्टीट्यूशन, ओके, फॉर ट्रांसफॉर्मिंग इंडिया. सो व्हाट हैज इट रिप्लेस्ड? नीति आयोग, नेशनल इंस्टीट्यूशन फॉर ट्रांसफॉर्मिंग इंडिया. वेरी गुड. नेशनल प्लानिंग कमीशन, ओके. सो नीति आयोग is this one. It National Planning Commission came into existence in 1950. 1st Jan 2015, Niti Aayog replaced this. Who's the chairperson of Niti Aayog? Prime Minister. It's like a think tank of India. ठीक है? So Niti Aayog has replaced Planning Commission. All right? Okay. True about school health guidelines. Quickly, school health guidelines का concept किसने दिया था? The concept of school health guideline was given by Board Committee. Okay, please don't say Renuka Roy. It was given by Board Committee. Minimum area is 5 square feet per student. No. Minimum area कितना होता है? Minimum area is 10 square feet per student. Minus desk type. Yes. Can allot 60 students per classroom. 40. Light should come from the front. No. It should come from the left hand side because most of our are right handed. So one classroom कितना होता है? Up to 40 students. Minus desk type. Doors and windows more than 25% of floor area. One urinal 60 students. One latrine 100 students. Natural lighting from the left side. And minimum area that should be covered is 10 square feet per student. School health checkup कब होना चाहिए? Once every 10 years, once every 6 months. Okay, all right. There's one more question that I want all of you to do. What is the answer to this? Vector for Zika disease. Zika disease का vector क्या है? Yes, very good. Vector for Zika disease, everyone, is which one is the vector for Zika disease? Renuka Roy ने बोला था once every 4 years. ठीक है? Is Aedes aegypti. Very good. Vector for Zika is Aedes aegypti. Okay, and Zika का life cycle देख लो, it is important. It transmits mainly through 4 routes. Aedes, sexual route, blood, mother to child transmission. That is equally important, mother to child, and it can present with microcephaly in the baby as well. Okay, all right. So I think we have revised quite a number of questions today. Okay, we will be meeting again pretty soon. But before that, please remember that at Unacademy, we have also launched the NEET PG Vitals now, everybody, okay, and which are recorded lessons by our wonderful educators. Okay, so these are the different phases of the lecture, like these are the different educators who are taking, and there's a rankers batch also which has been introduced, okay, so which is starting on the 10th of January, start ho chuka hai, and there is also a last leap marathon which is starting. Okay, so this was just a very small session where I just wanted you to not get out of touch with the subject, guys. With exams coming up, please don't worry, okay, it is not a very difficult time. You can definitely get through it. Just through these last few days, keep revising, be consistent, and I'm sure you're going to do well. Okay, so thank you so much, everyone. Be safe, and all right. Okay, any book? Okay, so there's a notes which is available now with the Unacademy recorded lecture. ठीक है? All right, so one second. Yeah, there's a notes which is available now with Unacademy recorded lecture. ठीक है? Which you can definitely access. All right, and pretty soon we're going to have this other things also available for PSM by me. Okay, so thank you so much, everybody. I will see you soon. Okay, all right, thank you. भैया, ठीक है?